subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We have a bright, some parts of the country perhaps a little rainy, inclement weather, but be that as it may, we are here at 5 p.m. on a Saturday evening, and we have here with us Dr. Siddharth M Shah. Before I start speaking with him, I will do a short introduction. Dr. Siddharth Shah is a consultant knee and hip replacement surgeon with over 15 years of experience. He has trained extensively in knee and hip surgery, including computer-assisted and robotic surgery at world-renowned centers in the UK, Australia, Singapore, and the US with eminent surgeons. He has a vast experience with over 2,000 knee and hip replacements, which include partial and total joint replacements, as well as complex and revision joint surgeries. He has published several pioneering research papers in several international journals and also authored various textbook chapters. He is a reviewer for high-impact international journals. He has presented his research at prominent global and national conferences and has several awards and recognitions to his credit. Dr. Siddharth Shah is associated with the SL Raheja Hospital, where he is a consultant orthopaedics and joint replacement, which is in Mumbai. The SL Raheja Hospital, as we all know, is in Mumbai. He is also attached to a few other hospitals. Welcome to Health Live, Dr. Shah. How have you been?
Thank you very much, Pradyumanji. I'm good. And thank you, Seniors Today, and yourself for inviting me here.
Thank you, Dr. Shah. Just before the webinar, we went live. I was just speaking to Dr. Shah, and this is something that we will speak even later. But Dr. Shah, I want to ask you this question. Now that there's a fair amount of awareness of health issues among the public, and there is one can do a search on the web for information. Do you often have people who come to you with say, doctor, there's something wrong with my femur, or there's something more specific, bones, etc. Do they come to you like that?
So yes, with so much information available online and through other media, people do their research before coming to us, and sometimes they have really gone into the depth. Now the problem is that the information which is available online or through other media, it is uncontrolled information. It may not be specific to their problems, but often people assume and even at times self-diagnose and would tell us that I think I have got this problem in my this bone. So I would suggest that it is best to leave the decision making to the specialist. When one visits the doctor, one must just present their problems and give a complete and detailed history and let the doctor do the rest.
Absolutely, absolutely. And I think very well said, Doctor. Today we've requested Dr. Siddharth M Shah to speak about managing bone health in seniors. Now, this is a subject that we may have dealt with before, but as we've got the feedback from various people, this is an issue which concerns everybody. And which is why we've, rather than look at specific things about knee replacement or arthritis, etc., that we've done in the past, my request to Dr. Shah is to talk about just managing bone health in general. And also preventive care, people who do not have any problems, how do they solve it? And if they do have some problem, then what do they take care of? So as always, we have requested Dr. Shah to make a presentation, which he will for the next 10 to 20 minutes. And once the presentation is done, please watch it carefully and send in your questions to us at the Q&A tab. As always, please put in your age and your gender so that Dr. Shah can give a considered reply. And remember, don't worry about making notes while the presentation is on. A recording of this will be put up on the Seniors Today website, as always, on Mondays, and you can take a look at it. There'll be a takeaways which is written by a medical practitioner. So all of that will be there. So don't worry, just keep watching and send in your questions. Take the advantage of having Dr. Shah in the house, and you can ask all the questions. Over to you, Dr. Shah, for your presentation, and then we'll take the questions later.
So good evening, everyone. Thank you very much for participating in this webinar. I'm going to talk about managing bone and joint health in seniors. When it comes to bone and joint health, there are certain peculiar problems which elderly individuals or senior citizens are afflicted, and we will talk about those in detail. So knee arthritis is one of the most common problems which affects seniors. Arthritis per se is inflammation of the joints. Inflammation can happen in any joint. The knee is one of the most commonly affected joints due to arthritis. Now, there are many different causes of arthritis. The commonest cause is osteoarthritis, which is due to wear and tear. And we are going to talk about this in detail in the subsequent slides. Apart from this, there is rheumatoid arthritis, which is an autoimmune problem. In this condition, there is a problem with the immune system of the body. Normally, the immune system will help us fight against bacteria, viruses, but here, because of a defect in the immune system, it starts attacking its own joint and tissues, resulting in inflammation and damage. Then there is another type of arthritis called post-traumatic arthritis. If somebody who has had a fracture in the past and the fracture does not join properly, then it can cause arthritis later. Then there is infection. Somebody can get infection like tuberculosis or bacterial infection in the joint, which can result in arthritis. Another condition which can lead to arthritis is gout. We know that when serum or when uric acid levels increase in the blood, it results in a condition called gout. This extra uric acid can deposit into the joint, causing inflammation and arthritis. So now let's look at knee osteoarthritis. This is a problem due to wear and tear. So during their lifetime, when an individual is continuously using or moving the joint, the cartilage in the joint will wear out. Once the cartilage wears out, the bones can no longer glide smoothly over each other, resulting in pain and inflammation. This condition most commonly affects people above 50 years of age. But I must tell you that of late, we are seeing more younger people being affected by this problem because of our change in lifestyle. This problem affects women more commonly than men. The prevalence of this problem in India is nearly 30%. So you can see that it's quite a common problem. The definitive treatment for advanced knee osteoarthritis is knee replacement. And presently, nearly 1.5 to quarter to 2 lakh knee replacements are performed in India every year. 97% of all knee replacements in India are for knee osteoarthritis. So what are the symptoms of osteoarthritis? Pain around the knee joint is the commonest symptom. Apart from that, patient can have swelling in the knee joint. Patients also often complain of noise. Patients would say that I can hear a clicking sound or a cracking in the knee joint when I move the joint. Or there is deformity in the joint. You all might have seen that somebody who has got long-standing arthritis, the leg starts to bend, and this bow-shaped legs are a result of the arthritis. These symptoms eventually affect the activity levels of the individual. Often people say that earlier I used to walk for about an hour every day, but now I can't even walk for 15 minutes, or I am now nearly completely homebound because I cannot go out. And all these factors result in a very poor quality of life. So why does knee osteoarthritis occur? We do not know the exact cause of this condition, but it is due to wear and tear. It is a part of aging. There is a genetic component to it, which means that if a person has a family history of arthritis, it is likely that the person will also have arthritis later in life. It affects women more commonly than men. There are certain risk factors which we have identified, and some of these risk factors are obesity. Now, as one can imagine that if the weight of an individual is in excess, then that extra load on the joint is going to cause the cartilage to wear out faster. But apart from this physical effect of extra loading, there is also a chemical effect. People who have excess fat tissue they produce certain chemicals in the body, and these chemicals also cause damage to the joint cartilage, causing it to wear out faster. Then diabetes is also a risk factor for arthritis. The high sugar levels in the blood, they cause the cartilage to become brittle, which will break easily and wear out faster. Then shape of the legs is also a factor which can result in arthritis. So individuals who have got slight bowing of the legs from a younger age, they are more likely to develop arthritis later in life. And then sports injuries also increase the risk of arthritis. Somebody who has played a lot of sports during their younger days, frequent injuries while playing sports can also result in arthritis later. So what should one do when they have arthritis? So first thing is to ensure that they keep their weight in control. When we want to know what is an ideal weight, we use a system called body mass index or BMI, and a person's weight or a person's BMI should be less than 25. If the weight is higher, it will increase the risk of arthritis. Now, to give you an idea about how weight affects arthritis. So when a person is walking, the load which is placed on the knee joint is about 1.5 to 2 times the person's body weight. When a person is climbing up and down stairs, the load on the knee joint is nearly 4 to 5 times of the body weight. And when a person is squatting or sitting cross-legged, the same load is nearly 6 to 7 times of the body weight. So you can see how different activities place different amount of loads on the knee joint. Now, if a person is obese, if that person is going to reduce their weight by 1 kilogram, then the effect, the benefit that the person will have on the knee joint while an activity of squatting or sitting cross-legged is equivalent to 6 to 7 kilograms reduction in weight. So because different activities have different loading on the knee joint, by reducing the weight even to a small amount can have a significant improvement in the symptoms of knee arthritis. Then there is activity modification. So as we have seen that certain activities like squatting and cross-leg sitting, they put excessive load on the knee joint. So by avoiding these activities, you can reduce the progression of wear. One must perform healthy physical activities regularly. So examples of healthy physical activity are walking, cycling, swimming. And by performing these activities, the strength of the muscles around the knee joint is maintained, as well as the flexibility of the joint is maintained. One must perform about half an hour to 45 minutes of activity or of healthy physical activity every day, about 4 to 5 times in a week. If somebody has diabetes, they must ensure that their blood sugar levels are under control. Smoking is a significant risk factor for progression of arthritis. So stopping smoking will also help to cut down the risk of arthritis. One can perform physiotherapy exercises. So physiotherapy focuses on improving the strength of the muscles around the knee joint. And as the strength of the muscles improves, it helps to redistribute the load on the knee joint, which can improve the symptoms. Apart from this, one can use painkiller medicines, which can help to reduce the pain. But one must keep in mind that certain painkillers have risk of causing kidney damage, stomach ulcers when they are taken for a long time. So one must be judicious while taking painkillers. An important thing to keep in mind is that so far we do not have any definite treatment which can help to bring back the worn out cartilage. What we can do is just ensure that whatever cartilage is remaining, it does not wear out quickly. However, what is already worn out is unlikely to come back with any existing treatment options available. So this is a rough stepwise management. As I said, if somebody has got knee osteoarthritis, changes in lifestyle and physiotherapy will help to improve the symptoms. If these are inadequate, one can use pain medicines. Sometimes when pain medicines don't help, we do some injections into the knee joint. So injections like steroids, or using a gel which can help lubrication into the joint, or certain special injections like platelet injections which help to increase the growth factor levels inside the knee joint can help provide relief for a short period of time. These injections also have a limited duration of effect. So it is not that these injections are going to cure the problem altogether. And when nothing helps, or when the arthritis is in the advanced stage, then knee replacement is the most definitive and logical treatment solution. Sometimes we may not offer injections and directly recommend surgery to people who have advanced arthritis. So this lecture would be incomplete if we do not talk about the myths about knee replacement. There are a lot of misconceptions that people have because of the information they read online or because of hearsay. So let's talk about some of the common myths. First is knee replacement must be delayed as much as possible. This is incorrect. This is an advice which used to be given about 20 years ago, because at that time the implants which we had were not of good quality and they would not last for a long period of time, which would mean that once they wear out, they would have to be changed again. But the quality of materials which we have available today is very good. Generally speaking, knee replacement implants can last for 20 to 30 years, and age is not a criteria. We would rather have the patient have a good quality of life rather than suffer in pain. So we do not recommend to delay surgery. Another myth is that the success of knee replacement is low. This also is incorrect. Presently, the success of knee replacement is about 95%, which is very good for any medical procedure. Another misconception people have is knee replacement is very painful. We have advanced pain management techniques like nerve blocking techniques, epidural analgesia, infiltration analgesia, minimally invasive surgical technique, which ensures that patients are absolutely comfortable after their knee replacement surgery. Then recovery takes a long time after surgery. This again is incorrect. With the newer techniques like fast track knee replacement, patients start walking within a few hours after the surgery. Most patients are able to walk independently within about 1 month after the surgery. So the recovery does not take long. Within a few months, patients are able to do almost everything. The only activities which we advise patients do not do is running or jumping, because these activities cause a lot of impact on the artificial joint and may cause them to wear out faster. Another misconception, very old or obese people should not undergo surgery. Age, as I said, is not a criteria. We perform general body tests before the surgery. If the patient is fit to undergo surgery, then age is not a criteria. Obese people can also undergo surgery. Sometimes there is a slightly higher risk of undergoing surgery in obese people, but with our newer techniques and advanced facilities, especially intensive care and medical care, obese people can also undergo surgery comfortably. I have several patients who are over 100 kilograms in weight and have undergone surgery. Some of the patients are over 135 kilograms and they have undergone knee replacements on both the sides without any problem. Then intensive physiotherapy is required after surgery. Well, after knee replacement surgery, exercises are required, but these are simple exercises which the patient can do on their own, and a physiotherapist is not necessarily required. Lastly, after surgery, my activity levels will be extremely limited. This is incorrect. My patients have run for Mumbai Marathon. They are playing sports. They are playing tennis, golf after knee replacement surgery. So as I said, that limitations after knee replacement are extremely minimal. Apart from running or jumping, almost all other activities can be performed after this surgery. Moving on to the next problem, low back pain, extremely common. 80% of people will suffer from backache sometime during their life. The pain can be felt in the middle of the back. Sometimes people can have pain in the buttock area. Sometimes it can be felt in the back of the thigh. Some patients may even complain of a shooting pain which radiates all the way down the leg from the back to the ankle or the toes. These are all part of the same symptom complex. there is another peculiar symptom called claudication, which people can have. So what is claudication? Here, when a person starts walking, after walking a certain distance, say for 10 to 15 minutes, they may experience severe numbness or heaviness in the legs, which will compel them to stop and sit down. As the person sits down, there will be improvement in the symptoms and the person can start walking again. So what happens is that when somebody has got advanced spondylosis in the spine, as the person starts walking, the pressure on the nerves increases significantly to a stage that they can no longer bear the numbness and the heaviness and they have to sit down. When the person sits down, the pressure on the nerves is released and the symptoms ease away and the patient can resume walking. So this is called claudication. Now, what are the common causes of back pain in elderly individuals? Again, very common degeneration or wear and tear, which we know as spondylosis. The spine also is made up of different joints. Wherever there are joints in the body, there will be movement. Movement results in wear and tear and degeneration, and this is what we call spondylosis. Another condition which can cause back pain is slip disc, where the disc between the two vertebrae comes out and it irritates the nerve. This problem is actually more common in slightly younger people. Then another problem is osteoporotic fractures. All of us have heard about this problem called osteoporosis, in which the density of the bone is reduced, which means the bone is more prone to fracture. And when this bone fractures, there will be pain. The spine bone is one of the most commonly fractured bones due to osteoporosis. Another common cause of back pain is an infection in the spine, like a tuberculosis infection or a bacterial infection. And sometimes cancer can cause pain in the spine. So the cancer could be a primary cancer, which means the cancer is starting from the vertebra, like multiple myeloma, or it could be a secondary cancer, which means there is cancer in another part of the body, like the prostate or kidney or the breast, and it is spread to the spine, causing pain. So let's talk about managing the most common cause or spondylosis for back pain. Now, certain things which the person must do whenever there is an acute attack of back pain, one must do rest. Rest should be limited, because if one performs bed rest for too long, then it can cause weakening of the muscles and it is not actually good in the long run. Then there is activity and posture modification. So certain things that a person must avoid is lifting heavy weights. If somebody wants to lift anything from the floor, then as you can see that lifting with bending of the back is not a good idea, as seen in the first series of pictures on the top. But instead, to lift anything from the floor, one must bend at the knee and then get up to lift it up. So this puts less strain on the back and will help your back pain. Other things which one can do is avoid sitting for too long in the same position. Make sure that the mattress you are using is a firm mattress. Often soft mattresses can make your back pain worse. Then weight management. Now, as one can imagine, somebody who is overweight, usually the abdomen or the belly comes out. Now, when the belly or the abdomen is coming out in the front, the center of gravity is moved in the front. So as the center of gravity moves in the front, the muscles of the back have to work harder to maintain balance of the body, which will cause them to strain and result in back pain. Apart from that, physiotherapy can help. Physiotherapy to strengthen muscles of the back will help to redistribute the load and help ease the back pain. When these measures are inadequate, we recommend certain medications. Now, medications could be pain relieving medications. They could be nerve modulating medications, which can help to reduce the back pain. If these do not help, we use certain injections in the spine. These can provide temporary relief from symptoms. Now, if the symptoms, before that, another thing which I wanted to show is that getting up from the bed. Now, as you can see, if you want to get up from bed, do not get up straight upright, but rather turn on one side and then get up. This again puts less pressure on your back and will help to ease your back pain. Now, if all the other measures for managing back pain have failed, then surgery might be the only option. Another common reason for performing surgery is a nerve problem. Now, the nerves of the leg, they come from the back and they go down into the legs. If the nerve is under pressure, then it may not be able to perform its function properly. What would that mean? So the nerves are mainly responsible for two things. One is to move the muscles of the leg, and second is to perceive sensation. So a person who has got severe pressure on the nerve, they can have an area of numbness or altered sensation in one particular part of the leg, or they may have difficulty in moving one part of the leg, like ability to lift the ankle up or ability to lift the big toe up is a sign of nerve compression. And if the nerve compression is severe, then a surgery must be done to relieve that compression in order to prevent irreversible nerve damage. One rare condition where again emergency surgery of the spine is required is what we call cauda equina syndrome. So there is a group of nerves which are present in your spine. When there is a severe compression of that group of nerves, the person can lose control of their motion or lose control of their urine. And this is an emergency situation, and emergency surgery must be performed to relieve the pressure. Now we move on to another common condition, osteoporosis. As I said, osteoporosis means loss of bone density. The bone becomes brittle. It is more prone to breaking. What causes osteoporosis? The commonest risk factor is age. As the individual grows older, the risk of osteoporosis increases. Diet is another risk factor. If your diet is deficient in calcium, vitamin D, proteins, and minerals, you are at an increased risk of osteoporosis. Certain medical problems, suffering from hyperthyroidism, cancer can increase the risk of osteoporosis. Certain drugs like steroid drugs or anti-cancer medications can also cause osteoporosis. As I said, osteoporosis increases the risk of fracture, and the commonest areas where fracture can occur are the spine, the hip, or the bones of the wrist. Now, osteoporotic fractures are more difficult to manage than any regular fracture, and hence prevention is better than cure even here as well. A special mention must be made about menopause in women. So we know that before menopause, women have normal levels of estrogen. Estrogen helps to maintain the bone density. However, after menopause, as the levels of estrogen hormone decline, the bones in the body, they start losing their density faster, and osteoporosis tends to progress at a more rapid rate in women after menopause. It is generally advised that after about 5 to 10 years of menopause, women undergo bone density testing in order to determine what their bone density is, so that corrective action can be taken before there is a fracture of the bone. So what must one do to prevent osteoporosis? First is to have a healthy, balanced diet, which is rich in protein, calcium, and vitamin D. One must perform healthy physical activities regularly. So with healthy physical activities, there is loading of the bone. Once you load the bone, it is a stimulus for the bone to remain strong and healthy. So as I have discussed, healthy physical activity, the examples are walking, cycling, swimming. They must be performed every half an hour to 45 minutes every day, at least 4 to 5 times in a week. One must ensure healthy body weight. Now, somebody who is extremely thin, they may have inadequate amount of fat tissue around the bones, which means that when they fall, there may not be enough protection of shock absorption by that fat tissue, which increases the risk of fracture. Similarly, somebody who is overweight, they may be producing certain hormones in the body which causes weakening of the bones. Hence, maintaining healthy body weight is also important to protect yourself from osteoporosis. Then, as I said, the problem with osteoporosis is that the bones can break, and in order to prevent the bones from breaking, the best way is to protect yourself from falling down. Now, seniors, obviously, with increasing age, the reflexes are slightly weak, and the risk of falls is high. So one must ensure that the furniture in the house is such that the risk of falls is minimized. If the seniors have to wake up at night, make sure that the place is well lit so that they can see and they can prevent a fall. If their vision is not good, the eyesight is poor, one must ensure that they take adequate measures to improve eyesight to prevent a fall. Then smoking and alcohol both have been shown to reduce bone density. So preventing these things or avoiding these things rather will help to improve bone density. If these measures fail to improve bone density, we have certain drugs which can improve your bone density. And finally, if there is a fracture, then we have to fix the fracture. Most of the times it requires surgery. However, some fractures can be managed with conservative treatment like braces or plaster. So these are some of the examples of osteoporotic fracture. The extreme left image shows a hip fracture. Now, hip fractures have a very high risk of morbidity and mortality. Hence, they must be treated as early as possible. If somebody has sustained a fall and is not able to move their leg, they must seek medical attention as soon as possible. Then these are other forms of osteoporotic fractures. This is a fracture of the shoulder. This is fracture of the wrist bone. And this image shows fracture of the vertebra. Once again, I would like to reiterate that prevention is definitely better than cure. But if somebody does sustain a fracture, timely treatment must be taken in order to reduce the risk of complications, especially after hip fractures. Now, one last thing I would like to mention about is this condition called avascular necrosis or bone death. And the reason why I want to mention this condition is that after COVID-19, we have significantly more number of patients presenting with this problem. So what is this problem? Avascular necrosis is a condition which results because of interruption of blood supply. When blood supply to one part of the bone is reduced, that part of the bone dies and it collapses. It can affect any bone in the body, but the head of femur, which is the hip joint, is the most commonly affected bone. The risk is significantly higher in patients who have recovered from COVID because often these patients have received steroid medications, and steroid is one of the most important risk factors for avascular necrosis. Now, this image, lower image on the left, what I am trying to show is this blue outline is where the ball of the hip joint or the head of femur should be, but it has collapsed, and you can see that how it is flattened into almost 2/3 of its size. When we cut this, you can see now this red area is where there is normal blood, but there is this wedge-shaped area which is white in color. This is the area where the blood did not reach, and this part has collapsed, and you can see that there is a gap between the cartilage cap and the bone. This is what avascular necrosis looks like. The X-ray on the top shows the normal ball of the hip joint, which is placed inside the socket. But here we can see that the ball of the hip joint is severely damaged. Now, why I am trying to give this information is that in the early stages, if this problem is picked up, the treatment can be done with medicines or simple surgery. However, if it is in the advanced stage or delayed presentation, hip replacement becomes the only option. Now, in the early stages, the symptoms can often be non-specific. The person can just have some pain in the groin or the buttock area. Often people think it to be some muscular pain or some strain or a ligament problem, and they may delay timely medical attention. And by the time patients present to us, they are already in the advanced stage where hip replacement becomes the only option. So if somebody who has had COVID in the past or has taken steroid medications in the past, if they have any pain around their hip joint, they must take timely medical treatment. With this, I conclude my talk, and I would be very happy to take your questions. Thank you once again for listening.
Thank you very much. Thank you very much, Dr. Shah, for this very detailed presentation. And we have so many questions that have come in, and I'm going to start taking the question one by one, if it's okay with you.
Sure.
So there is Dr. Shyam Mahajan, who's 71. He says, are there any medicines that reduce chances of arthritis? I mean, preventive.
So there are no medicines which have been shown to reduce the chance or risk of arthritis. The things which are proven are ensuring a healthy, balanced diet, regular physical activity, keeping your weight under control. If you have conditions like diabetes, ensure that the sugar levels are under control, avoid smoking, prevent sports-related injuries. These are the things which are proven to reduce the risk of arthritis. No medicine can prevent the risk of arthritis in the future.
Right. Doctor, there's, I know you made this in the presentation, but some questions that have come in, and one question that has come in, which is not very coherent, is if one does have some pain in the knee or some pain in some joint, does one still go out for a walk, or does one just stop short?
Right. So this is a very common misconception. People think that if there is pain in the joint, if there is beginning of arthritis in the joint, they must reduce their physical activity. It is incorrect. In fact, it is actually going to do more harm. Now, if somebody has got early arthritis or even advanced arthritis, one must continue walking. It helps to maintain the strength of the muscle. It helps to maintain flexibility of the joint. Only certain kind of activities should be better avoided, as I said, like squatting, cross-leg sitting, unnecessary climbing up and down of stairs. But a simple activity like walking should be done within the limits of comfort. So it is a misconception that you should stop all activity if they have pain, because it is actually going to do you more harm.
Thank you. Doctor, I'll rush through the questions because it's 5:40 already. I'm nearing 5:40. There's a question from Girija Ganesh, who asks, it's said that lifting objects should be done with a bent knee. What if the knee pain already exists?
So this is certainly a tricky situation, because although knee pain and back pain can coexist, but you will have to see which one is the worst. If your back pain is worse, then certainly you must bend at the knee. But if your knee pain is worse, then you will not be able to bend your knee properly. I do often advise patients that whenever possible, don't hesitate to take help. If there is a heavy object which must be lifted from the floor and you have some back or knee problem, just request somebody else to help you with that. So if there is a severe knee problem, then I think, it might just be better to ask for somebody's help.
Before I go on to the next few questions, I must underscore the fact that while this webinar is there and we have, a very seasoned doctor in the house, but some of your problems might require clinical examination and a direct connect with the doctor. So either you speak to the doctor, meet your doctor yourself, or get in touch with Dr. Shah, who will be available for a teleconsult at SL Raheja Hospital. But do ask specific questions. We will, of course, ask these questions that you have posed, but specific medicines, etc., they cannot be answered in a webinar forum like this. I'm going to ask the next question, which is from Mr. Brijendra Kumar, who's 78 and based in Mumbai. He says, I have wear and tear in my left knee joint, osteoarthritis, but my ortho suggests that there's no immediate need of knee replacement. I do get pain in the movement. Request, please advise a suitable painkiller, and which is why I made that disclaimer earlier. I have been advised knee exercises, which I do.
Okay. So again, thank you, Pradyumanji, for reiterating. For specific advice pertaining to a problem, it is always better to once discuss with your doctor, because clinical examination is the most important thing before giving any advice. Now, see, as the gentleman has rightly said that if the arthritis is not severe enough, then you may not be advised surgery. Knee replacement surgery is advised when the arthritis is in its advanced stage. Early stages of arthritis, lifestyle modification, physiotherapy are the methods of reducing pain and symptoms. As far as pain medications are concerned, there are many different types of pain medications. Every medication does have risk of side effects. Some of the safest medications are paracetamol-based medications, which people often take. These are available over the counter also. But the best thing to do is to just request your doctor, and he will be happy to prescribe you a pain medicine.
Doctor, what about, for instance, even I have a medicine like this in my drawer, and I just pulled it out, which is, say, a Combiflam, right? Now, is it safe to have all these kind of medicines? You have some pain and you decide to pop in a Combiflam or something of that type, or apply an ointment. Is that safe as a first cut, improvement? Perhaps, say, on a Saturday evening, if you suddenly develop some pain and it's impossible to reach a doctor.
Right. So see, again, topical applications in general are safe. Applying an ointment or a gel, because it is mostly acting on the surface, it is not going into the system of the body, the risk is minimal. Now, say, for example, as you mentioned, Combiflam. Now, if a person who already has problems of the kidney, it is actually going to cause harm if the person takes Combiflam. So it is not advisable to take painkillers. Again, now painkillers are of different types. Some paracetamol-based painkillers they have a very high level of safety as such. So unless a patient has got severe problems of the liver, paracetamol-based medications are okay. Certain other types of pain medications, they are not suitable for people who have kidney disease. So with every pain medication, there is always a possibility of side effects, or they could be contraindicated in your condition. So it would be a good idea to just take advice of a doctor before taking pain medications on your
own. Right. Doctor, this is a question that has come in now, but it's interesting because we are getting into the veins now. This is from Lax Lalita. Is joint pain like knee, ankle related to weather conditions?
So now it is true that in cold and damp weather, people usually complain of joint pain more frequently. So in terms of feeling the pain, yes, it becomes more common in damp conditions and in cold weather. However, the weather per se does not increase the risk of having joint arthritis, inflammation, or cartilage damage. To put it in other way, the prevalence of joint problems in places which have hot climate and in places which have cold climate is identical. So it is not that the weather in itself is causing any inflammation or damage in the joint, but yes, the perception of symptoms like pain, stiffness is more in cold and damp weather.
Right. Doctor, there is a question that we are getting into the rains now. Is it all right to be walking in the house without your shoes on, or does one need to wear shoes while walking in the house?
So in general, walking bare feet is completely fine. Only some people who have got certain problems of the heel or the calcaneum bone, their doctors may advise them to put on a footwear while walking. But generally speaking, if you do not have any problems of your heel or your feet, it is fine to walk within the house without any footwear.
As Grija Ganesh asks, is it okay to walk indoors for 30 minutes?
That is completely fine. Yes.
Doctor, we have just so many questions that have come in. Is it okay if we take another 5-10 minutes?
No, certainly. Please, I'd be more than happy to answer all the questions.
So this is by Mr. A.K. Chopra, who's 73. Doctor, as you see that, we have so many people who are above the age of 70 and they're all very active on Zoom, and they're asking questions to us, so which is very heartening. as you would, I'm sure,
I
concur.
agree. Yes.
So this is a question from Mr. Anil Kumar Chopra, who's 73. He's suffering for knee, he says, but I walk for 40 minutes and cycle and do yoga. But doctor advised knee replacement, but there's no swelling in the knee and there's little noise. Please advise whether how to avoid knee replacement. And he says BP and sugar are under control.
So, see, I mean, I have not been able to have the complete profile of your case, but based on what information I have, see, first thing I would suggest is that if the doctor has advised, I'm sure, he is, he knows the reason why he has advised you a knee replacement. While you may not have swelling, sometimes patients may have other signs of advanced disease like bowing of the legs. Or let me explain to you in a bit of detail. Now, when there is one joint of the body which is worn out, it means that that joint is not working properly. Now, the body will have to place extra load on another joint in order to compensate for it. So somebody who has got a worn out knee joint for a long time, they may start having other problems like back pain. They may start having problems in the hip joint. So while it may appear that the person is able to perform good enough physical activity like walking for 40 minutes, there may not be any external swelling, but there may be other signs like change in shape of the legs or pain in other parts of the body, or the X-ray which suggests severe damage, which would mean that a knee replacement is a suitable option. Another thing is that pain is a subjective symptom. Some patients might be able to tolerate pain better, but many times when they continue to delay their surgery despite severe arthritis, they may end up wearing out the bones also. So in arthritis, first the cartilage is worn out. In severe cases, the bone will also start wearing out. Now, when the bone also wears out, it makes the surgery more difficult and the success rate might be slightly reduced. Hence, the doctor might have advised you knee replacement surgery despite your high levels of physical activity and minimal swelling. Now, your second question, how to avoid knee replacement? So as I said that, there are no medications. What you can continue doing is to maintain good level of physical activity, keep your weight under control. If, you already mentioned you are not diabetic, but if you are diabetic, make sure the sugar levels are under control. Avoid activities like squatting and cross-legged sitting, and this should help to keep the symptoms under control.
Right. Thank you. Doctor, a few questions which I'll just rush through is from Suresh Nanda, who's 65. Is cross-legged sitting posture harmful? I don't have any health issues, he says.
So now, cross-legged sitting after a certain age is definitely not good for the knees. If you really have to sit cross-legged, then it is better to first sit on a chair or a sofa or a bed, and then cross-leg sitting is okay, because when you do that, the upper body weight is already supported by the buttocks. Then if you cross the legs, it puts less load on the knee joint. But if you sit cross-legged on the floor, then the weight of the upper body is on the knee joint. So in general, after a certain age, it is not advisable to sit cross-legged. If you do have to sit cross-legged, it is better to do it on a chair, on a sofa, or a bed.
Thank you, doctor. We have Mr. Madhusudan Bhandarkar, who asks, I am 71 and he had suffered a sports injury on his right knee about a decade back. Can I undergo robotic knee replacement surgery? And he asks the question, what will be the cost and time of recovery?
Right. See, certainly one can undergo robotic knee replacement surgery. Now, what was the sports injury? More details are required. Usually, sports injuries mean that it is a ligament injury, and that should not be a problem in undergoing a robotic knee replacement surgery. The cost of surgery, as one can imagine, is going to be highly variable. It will depend on where you are getting it done, but generally speaking, in the city of Mumbai, cost of a robotic knee replacement surgery can be as little as 2.5 lakhs to even up to 5 to 6 lakhs. So I think you should just go to the place where you intend to get the surgery done and inquire about the cost. Also, it would depend on the room type. A suite class will be built differently than a twin sharing, for example. So specific cost information can only be provided at the place. As far as recovery is concerned, so generally speaking, recovery after knee replacement surgery is quite quick. As I said, patients can walk on the same day after surgery. Most patients can walk independently after about 4 to 6 weeks after surgery. To give you a very specific information about recovery, recovery mainly depends upon how active the person was before surgery. A very active person before surgery is going to recover faster after the surgery. During surgery, we give a new artificial joint, but to move the artificial joint, the muscles are the same muscles which were there before the surgery. So if your muscles have been active and healthy before the surgery, your recovery after the surgery is going to be faster. Another factor is the severity of arthritis. If somebody has had extremely advanced or severe arthritis, they are perhaps going to take a little longer to recover.
Right. We have a question from Mr. Shyam Mahajan, who says that, yoga mentors advise cross-sitting, cross-legged. Should we avoid such asanas?
See, first of all, yoga certainly is very useful because it helps stretching of the muscles, it helps strengthening of the muscles, and flexibility of the joint is improved. However, somebody who already has knee pain or after a certain age, I would advise that they avoid asanas which require cross-legged sitting. If you want to perform those asanas, it is better that you do these asanas while seated on a higher level, like a chair or a sofa or a bed. As I mentioned earlier, when you are already seated on a higher level, the weight of the upper body is already supported by the buttocks. So now when you fold your legs to sit cross-legged, you are not putting so much load on the knee joint. So first, better to avoid. If you still have to do, just do it on a higher surface.
Right. We have one last question. There are quite a few questions already there, but we're going to request you to come once again soon, Dr. Shah. We have Mr. Trilokinath Dubey, who asked, my wife is suffering from bursitis. Is there
Sorry, I beg your pardon, suffering from?
Bursitis.
Bursitis. Okay. Sure.
Bursitis, sorry. Is there any special care to be taken?
Bursitis can be there in any part of the body. It could be there in front of the knee joint. It could be there around the hip joint. So, is there a mention which part of the body does the bursitis involve?
He hasn't mentioned that.
Okay. Now, generally speaking, bursitis. So, bursa is basically a fluid-filled sac.
Hip is what he says. He just replied.
Okay. So, in general, for bursitis, which is present on the outer part of the hip joint, just certain changes in activities, avoiding sleeping on that side, taking anti-inflammatory medications will suffice. In certain cases, we may have to give a local injection of steroid medicines to relieve the inflammation. And in certain rare cases, the bursitis may actually be because of a more serious problem like muscle injury, and that can be found out on an MRI.
Right. Thank you very much, Doctor, for being there. There are quite a few questions that have come in. Mr. Sri Krishna Agarwal, Mr. Ravi Gandhi, Mr. Kamal Bajaj, Mr. Vijay Hebbal, Ms. Akhauri Kumar, Babulal Tori, Katie Daranchi, Shrikant Kulkarni, some anonymous attendees, Shamlal Ravi, Ruplata. I'm going to, as I said, I'm going to request you once again. I will speak to your, to the hospital and try and request you for some more time, because as we can see, we've had quite a few people who have come in over here, and there are quite a few questions that have been left unanswered. But thank you very much, Dr. Siddharth Shah, for being here. and taking some valuable time out and working on this presentation, especially for seniors. I understand you have a very busy schedule, and just being there for this session and answering all the questions has been amazing. Thank you very much once again, Dr. Shah, for being here.
My
We
pleasure.
will be once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. And I must not forget thanking the people at Fortis and SL Raheja Hospital for facilitating this. Thank you very much once again. We will be, apart from Health Live at Seniors Today, about the Seniors Today magazine. We're going to be out with the anniversary issue on fourth anniversary issue on July 15th. There are a host of sessions which happen every day of the week, and you can get to know more about them through our website, through our social handles. And next week, that is July 2nd, is the finale of our 11th season of Seniors Have Talent. So those of you who enjoy music and those of you who would like to see who's going to be winning the Seniors Have Talent, as you know, there's no first prize there. There's no first, second, third prize there. We consider everybody a winner, and we have 10 super singing superstars, as we call them, and they will be they'll be selected on the basis of the songs that they sing. We're going to give them some themes. We have judges in the house, and that's how it happens. Thank you very much once again, Dr. Shah, for being here, and thank you all for being there. We will be back once again next Saturday at 5 p.m. Thank you.
Subscribe now and press the bell icon. Never miss an update.